So good evening all. Today our topic of discussion is the stroke. So before going to know about the stroke, first of all the blood supply of brain is very important, and the arteries or carotid supply of the brain is very important. So there are two carotid arteries are there on front and two vertebral arteries are there on back. So normally the right carotid artery will arising from the right brachiocephalic trunk, and the left carotid artery will arising from the direct branch from the aorta. Next, again this common carotid artery. Again, it was divided into external carotid arteries as well as internal carotid arteries. Internal carotid arteries will supply to the parenchyma of brain, and external carotid arteries will supply to the face and the other extracranial structures. Next, on back side, so there are two vertebral arteries are there, and they are direct branches from the subclavian on both sides, and especially at base of brain, so these two will form basilar artery and supplies the posterior part of the brain, are the structures of the posterior part of the brain. So antecerebral artery and midcerebral arteries are the branches from the internal carotid arteries, and posterior artery is arising from the basilar artery. So these three arteries will form the. So there is so much of anastomosis by communicating arteries and form the circle of Willis. So the circle of Willis is the very important for location of the lesion and symptomatology of the stroke. Next, what are the types of the stroke? So usually, there are two types of there: ischemic stroke and hemorrhagic stroke. Ischemic strokes are responsible for 85% of the strokes, and the commonest cause for ischemic stroke is the atherosclerotic related thrombus in India. But according to the international textbooks of medicine, the commonest cause for ischemic stroke is the cardioembolic causation. Next, so the commonest location, so it is the putamen. Next, hemorrhagic strokes. Hemorrhagic strokes are 15% strokes are the hemorrhagic strokes. So there are so many types of there: intraparenchymal, subarachnoid, subdural, extradural, intraventricular hemorrhages. So there are 5 to 6 types of the hemorrhagic strokes are there. So the commonest is intraparenchymal hemorrhage, and the commonest cause is hypertension, and the commonest location is cardiac nucleus. Next, SAH. SAH and SVH are usually responsible for the 1 to 2% of the hemorrhagic strokes among the 15%. Next, so the commonest cause for SAH is trauma or head injury, and the commonest non-traumatic cause is arteriovenous malformation, arteriovenous rupture. Next, what are symptoms? SAH. So there is subarachnoid hemorrhage. So there is the filling of the blood in the subarachnoid space. So there is excruciating pain. So the patient tells that it is the worst headache in his life, and along with the headache, other meningeal signs like neck stiffness and kidney sign and Wedgkin sign will also be positive in SAH. Next one is SVH, subdural hemorrhage. Subdural hemorrhage is usually caused by the rupture of bridging veins, which means these are the connecting veins between the duodenal venous sinuses as well as the cortical veins. So when these are ruptured, automatically subdural hemorrhages will take place. And the usual presentation is post trauma. So the patient is not aware of the trauma, as usually after 2 to 3 weeks. So there is a slowly bleeding takes place into the subdural space. Next, extradural hemorrhage. Extradural hemorrhage. So the commonest cause is head injury. It is due to injury of the middle meningeal arteries. Next, IVH. Good. So when the intraparenchymal bleed was extensive, so it may lead to the IVH, which is the most fatal condition. Next, so what are the important points on